Good afternoon. Happy Tuesday. This is Holly Jennings with Tuesday's Tips and Talks, and we are so excited because today I get a few minutes to talk with Tiffany. She is with AdventHealth Memory Care Clinic. Thank you for coming this afternoon.
Thank you for having me.
Oh, we're so excited. So we're going to spend a few minutes and get to hear a little bit about over at AdventHealth and what the Memory Care Clinic offers for the community. So Tiffany, just take a few minutes and tell us a little bit about that.
Well, when people come into the clinic for the first time, we actually speak with them providing psychosocial assessments or completing psychosocial assessments to determine what they're in need of. And a lot of times families, they're in need of support. That support can look anywhere from, placing their family out of home placement, whether it's assisted living or nursing home. So we assist with that. We connect them to the different referral sources that can link them to the service that they're in need of. In addition, we provide packets, informational packets as it relates to the diagnoses that they potentially may receive that day, or if they already come in with a diagnosis, we help support them in that area, whether it's ways to communicate with their loved one who's suffering from the disease, or it could be walking them through the different stages of what that disease look like. So again, we just offer an array of services, whether it's out-of-home placement, whether it's connecting them to Senior Resource Alliance, or private pay, where someone comes into another's home and be their home companion, their companion provider.
Wow.
So we offer various services as it relates to what they're in need of.
That is awesome. Well, here at Premier Senior Consultants, we help families find those senior living options that she was talking about. And what a wonderful service, because we have a lot of clients that come to us kind of in that first step, and they don't even know where to start, especially when their loved one has dementia or Alzheimer's. And so what a wonderful resource. That's why we wanted to sit down today and know that there's some resources out there for you. So you'd mentioned a little bit about whether they already have the diagnosis or not. So let's say they do already have their primary care provider they've been going to for the longest time. Can they still keep that provider, or how does that work, like in hand in hand, like when they're looking for that?
Absolutely. I mean, we encourage them to keep their PCP and their neurologist if they've already been diagnosed, because Dr. B, she's actually a gerontologist, so she deals with patients that are 65 and older. So again, yes, we encourage to keep your primary care provider because you're in need of that. They provide your other medications that you may be in need of, and we focus on the memory care. We focus on brain health.
Good. So it's not to replace that person. Some people are very, obviously, they have that tie that's important. But Dr. B, tell a little bit about Dr. B and who that is.
Well, Dr. B, she's very special. She came to us in September, and she's been working with the clinic, very informative as it relates to dementia and the care of our patients.
Well, a little bit about her. You were saying that I know we got a chance to meet her.
Yeah.
So that was really great. And she has such a great and warm bedside manner and just interacts with everybody.
Absolutely.
So I think that she is just a wonderful addition for you guys, because you guys had someone before for the longest time, and she was able to come in and kind of pick up the patients and actually walk alongside them.
Yes.
So I think that was wonderful. But it's been really great to work with them, and we've had the opportunity to really get to know some things that they do, because we have clients that need that support. Another thing that I think is really great that they offer is the support groups. Right?
Yes.
Do you have support groups as well for families?
Yes, we absolutely have support groups. We have the music group where we have clinicians come in and support that. They do little sing-alongs, and I've actually joined in because I enjoy singing.
Yeah.
So I participated in one of those little groups, and it was very nice. But again, with the support group, we also have where caregivers can come in and talk with the clinicians about what they're experiencing, and the other family members are there to discuss what they have been experiencing. So it loops everyone together so that they will not feel alone while they're caring for their loved ones.
Yeah, that's really helpful, because we see, there's the caregiver burnout that we talk a lot about, and we're seeing that some people are staying in their homes longer. We had that issue with COVID. That was a big reason that some people were staying longer. And so then when that finally lifted, we saw a lot of people come to us and say, gosh, I really need the support. And whether it's that you choose to move your loved one into memory care or decide to keep them at home, the memory care clinic can really help you, whether it's support groups, whether it's seeing Dr. B, anything like that. What about, I'm trying to think of like clinical trials, or is there anything else that you guys are able to kind of connect them with, or
Oh yeah, we
things like that?
absolutely connect them to clinical trials if they desire.
Okay.
We do.
Okay, great. Another question that I get a lot that I don't always know the answer is, what does insurance cover and what does it not cover? You talked a little bit about, I know that like if they come into the clinic and see the doctor, obviously, but like the support groups, those are free. Like they're just
those are
nothing,
free.
they don't have to worry about paying anything out of pocket.
No.
I think a little bit when we talk about getting the resources, like someone coming into your home, that is private pay a lot of times.
Yeah, those are private pay most occasions, but there are some that have long-term care plan, and when they have a long-term care plan, then that's something that they have paid into over the years.
True.
And then they're able to get that support, and that's something they don't have to pay at that time because they paid over the years as it relates to that service.
Yeah,
So
that's a good thing to bring up, and a lot of people also don't realize those that were veterans, there's VA aid and attendance that can help. You mentioned the Senior Resource Alliance.
yes.
And do you work a little bit or refer out to that as well?
We do refer out to them. Sometimes I'll place the call. And when I place the call, it's just so that Senior Resource Alliance can gather little information about the patient that I'm calling on. And at that time, they'll go ahead and schedule a visit for that patient. And at this time, the scheduling is about a month out. So you will have to wait a little. So if you need services within that time frame, then you are encouraged to supply that need by paying for private care until you speak with Senior Resource Alliance so that they can identify your need, and then they go from there.
Okay, that's really good information. But we're always, the one thing that we want to encourage you about, and the reason why we do these series, is to know that you're not alone and we all have resources for you. One thing that we do, and you'll see at the end of the video, is that we'll put up all the information. If they're hearing this today, what's the best way to contact you guys? And I know that we'll put that up in the chat at the end, but what is the first step, would you say?
The first step is just to reach out to AdventHealth Memory Care Clinic and speak with one of our care coordinators.
Okay.
And by doing so, you'll place a call or you can send an email.
Okay. I do know that there's a little bit of a wait list, I've heard, not to be discouraged, right?
Yes, please don't be discouraged. There is a waiting list, but we are working through those as quick as possible. As of right now, we're seeing up to 4 new patients a day while still maintaining our follow-up patients as well. So we are working very diligently.
Yes, I've heard about that. I've heard that they have some new people coming on their team. 4 new patients a day, that is encouraging, because some people, they get that call and they're pushed out for months and they feel like, what are we going to do?
Yeah.
But also keep in mind, if you get on that wait list or you're waiting for your new patient appointment, there's the support groups, there's other things that we can do while you wait.
Yes.
So definitely utilize this resource. So we want to just kind of recap that, Tiffany and the AdventHealth, the Memory Care Clinic, they're there to help you. We're going to put their information in. Always know you can call us here at Premier Senior Consultants, because even if we start the preliminary process of just talking you through what are your options, what does it look like, we don't want you to wait for the crisis. We want to help you figure out something that you can do to plan ahead. So that's what we are all here for. That's why we do these things. So just be on the lookout. Definitely check us out. Make sure you reach out to either us at Premier or them at AdventHealth. Either way, we're going to get the resources that you need. So thank you so much for sitting down with me this afternoon. This has been great. I hope that it's been helpful for you guys, and we hope you have a great afternoon, and we'll see you in a couple weeks. Thank you so much.
Thank you.
All right, thank you.